Hello. Rudo and I did our presentation on Taxol. Taxol is a cancer treatment drug that treats various cancers, including cancer in the lungs, ovary, and breast. It can also be used to treat Kaposi sarcoma in people who have AIDS. Taxol is labeled as an antimicrotubule agent. It interferes with microtubule formation. However, it's unlike previous drugs, which only inhibited the polymerization of microtubules. Taxol actually induces polymerization of microtubules in such a way that not only does it prevent spindle fibers from forming in association with the centrosome and kinetochore during the cell cycle, it actually leads to what are called asters, which are spontaneously formating areas where spindle fibers form from. It's actually the star-shaped um, formation that occurs. So what Taxol does is it actually lowers the critical tubulin levels, causing these spontaneous centers from which these spindle fibers now grow from. And they continue to polymerize, and they're actually safe from the normal degradation mechanisms of a cell. So if you mess with the ion concentration, or you lower the temperature or anything in the cell, they're not going to depolymerize as they normally would, and therefore they're relatively stable. And what this does is it slows down the cell cycle, because the cell cycle still occurs. It just basically occurs a lot more slowly, and essentially anaphase and metaphase do not go as it should, as there are no proper spindle fibers to properly align the chromosomes or separate them, which means that Taxol also prevents the proper separation of chromosomes. And most of the cells will die just simply due to the gene dosage problems, the fact that they weren't properly separated. Some, however, will make it past that stage and will separate further, and those cells will also die, also to a disproportionate distribution of chromosomes. And so Taxol actually comes as 1 milliliter of a sterile non-pyrogenic solution. It's a powder, generally white, could be like a little bit off-white as well. It needs to be dissolved in a solution, diluted and everything, and it contains 6 milligrams of paclitaxel, 527 milligrams of polyoxyl ethylated castor oil, and about 49.7% dehydrated alcohol. And it is injected intravenously. So what they do is they set you up on an IV and they just kind of push it through that way. With this comes a risk, however, of irritating that area. It can irritate the vein itself, or the medicine can leak out and irritate the surrounding area. And that can cause redness, pain, swelling, and discoloration. Some of the common side effects that occur shortly after being administered the drug include nausea, vomiting, diarrhea, mouth sores, muscle and joint pain, flushing, dizziness, drowsiness, temporary hair loss, numbness, tingling, and burning, and it infrequently may cause changes to your blood pressure and heart rate. And that last fact is actually one of the primary reasons why doctors do not recommend that you take Taxol outside of a doctor's office, simply because they need to monitor you after you administer the drug, just so that they can basically save your life if it does happen to affect your heart rate or blood pressure in a very devastating way. They also recommend that you keep in touch with your doctor and you let them know if later on you have any of the following side effects, which include signs of anemia, which means that you get like tiredness, pale skin, you get a little colder in your extremities, you have easy bruising or bleeding, fainting, confusion, pain, redness, swelling, weakness of the arms or legs, calf pain, swelling that is warm to the touch, coughing up blood, persistent nausea and vomiting, stomach or abdominal pain, yellowing eyes and skin, dark urine, vision and hearing changes, or if you have seizures. And that is all. Thank you.